Hi friends, I am Dr. Pratap Singh Rathod. I have done the MD in Pharmacy Medicine. In today's video, continue with substance abuse. We'll discuss about types of dependency. There are different types of dependency classified based on which product the person consumes. One is morphine, barbiturate type, cocaine type, cannabis type, amphetamine type, and some other forms of dependency. Coming to morphine type, in this it refers to addiction to morphine, heroin, opium, or morphine substitutes such as methadone. In this type, there is overpowering desire to need to continue to taking the drug and to obtain it by any means or by tendency to increase the dosage to development of tolerance. So here the person usually develops tolerance and dosage increases, and to get the dosage he will do any measure necessary to consume to get that dosage. The morphine is usually taken by IV, IM injection or by sniffing up the nose. In opium abuse, there is always a high degree of cross tolerance in the to other drugs with similar pharmacological action. Tolerance develops at different rates at different effects of opiates. Example, heroin withdrawal starts within 8 hours and peak at 48 to 72 hours. Morphine and amphetamine exhibit a high degree of tolerance and physical dependency develops. Withdrawal symptoms, it occurs after withdrawal of the drug for more than 12 hours and lasts about a week. Yawning is commonly seen feature of withdrawal. Minor withdrawal symptoms include dilated pupils, pallor erection, yawning, rhinorrhea, myalgias, cramps, lacrimation, anorexia, perspiration. Moderate symptoms include restlessness, insomnia, hypertension, tachycardia, tachypnea, diaphoresis. Major symptoms include vomiting, diarrhea, hyperactive bowel sounds, and hypertension. Cause of death in morphine type. The death is caused by cardiac arrest following arrhythmia and ventricular fibrillation. Death may be so rapid that needle may still be found in the vein when the body is discovered. Treatment. Standard therapeutic regimen involves morphine type drug of for 10 to 14 days is sufficient to cause dependency on the drug in majority of patients. Methadone 25 to 50 mg twice daily helps to recover from the tolerance of morphine. Next type of dependency is barbiturate type. In this type, the desire to continue the drug is strong and the tendency to increase dosage is partly due to tolerance. So usually barbiturate type develops when the person is prescribed some barbiturates and he starts taking that and get habituated and becomes tolerated. Tolerance develops. There is a cross tolerance between these drugs and alcohol. Usually the person consumes alcohol with barbiturates to get sleep, and which leads to cross tolerance, and together they make a powerful and potentially lethal combination. The withdrawal symptoms reach maximum of 2 to 3 days and subside slowly. Earlier signs of withdrawals includes tremors, hyperreflexia, diaphoresis, irritability, restlessness, anxiety, tinnitus, nausea, vomiting, paresthesias, transient hallucinations, confusions, illusions, insomnia, depression, tachycardia, tachypnea, hypertension, conversions. Later signs includes profuse diaphoresis, marked disorientation, persistent hallucinations, extreme agitation, tremors, restlessness, hypothermia, tachycardia, tachypnea, orthostatic hypertension. Next type is the cocaine type. By consuming the cocaine, in this there is desire to obtain a drug is overpowering, but tolerance is absent. Tolerance is absent and doses required for large doses is not required, but the person is habituated to cocaine. There is a psychological dependence on the drug and no withdrawal symptoms are usually seen. It may cause progressively intense toxic reaction including paranoid psychosis, and its use may be combined with that of heroin or some other morphine like compound. So because of that, the person usually gets some withdrawal symptoms because it is usually combined with also morphine, leading to cross tolerance. There is a profound mental depression which may lead to severe mental dysfunction. It produces hypertension which may lead to cerebral hemorrhage and even death. So usually cocaine develops some form of psychological dependence, and stoppage of that usually leads to some psychological symptoms. Some paranoid psychosis also develops. Next is a cannabis type of dependency. In this type, there is a need or desire is present, but there is no tolerance and usually no dose increase is required. Again, cannabis also, it doesn't form tolerance. Again, it only develops some form of psychological dependence. There is psychic dependence only and no abstinence syndrome is seen. The danger of cannabis is not that itself but in the environment in which it may be consumed. The person under the influence of cannabis may injure himself or cause harm to others. As the withdrawal symptoms is mild, supportive and symptom treatment is only provided. Next is the amphetamine type. In this may be combined with barbiturates. Usually amphetamine may be combined with barbiturates leading to cross tolerance. Here the need or desire is present and there is a tolerance to the drug and tendency to increase the dosage. So amphetamine develops tolerance and which requires the increase in dosage. Dependency is psychic and there is no absence syndrome, but continuous use of amphetamine may lead to severe hyperexcitement, hallucinations and psychosis. So it is mainly causes psychological dependence leading to some hallucinations and psychosis. There is hyperpyrexia, hypertension, which may occasionally precipitate a cerebral or submagnum hemorrhage, and a risk of cardiac arrhythmia also is present. Some other forms of dependency is combination of drug usage. Here the effect of drug combinations are different from each drug taken singly, and mixture of drugs are particularly liable to lead to tolerance and habituation. So drug combination includes use of different types of dependent drugs leading to some adverse effects and cross tolerance and habituation. Loss of tolerance, where there is a loss of tolerance following withdrawal during hospitalization or imprisonment. The addict on being released often goes back into his old environment and resumes his addiction, taking the same dosage that he did before, which may cause death. So usually the person's tolerance decreases once he gets hospitalized, and once he releases from hospital he may go take the same large dose and may lead to death. Cotton fever is a condition where it develops from due to injection of water, extract of the cotton remaining after the heroin supply is used in the bag. So usually the cotton which is used to store the bag is water is evaporated, is injected from the cotton, soaked in the cotton, soaked with the drug, leading to cotton fever. Then drug abuser's elbow is a condition where there is a myositis ossification develops due to repeated usage of needle punches near the elbow in the eye of drug abusers. Then one form body package syndrome or also surgical muse is a seen in some drug form of drug trafficking. Here there is illegal drugs such as cocaine, heroin, amphetamine and cannabis are compressed into cylinders of about 25 to 12 millimeter and heat sealed in plastic films and wrapped again in multiple layers of latex like condoms, balloons, foils, fingers of rubber gloves, etc. and swallowed. So once they in the stomach, one packet may contain about 3 to 7 grams of narcotics. Drugs such as loperamide or diphenhydramine hydrochloride with atropine may be taken to reduce the gut motility to prevent the passage of package on the long distance flights before the end of journey. So they usually consumed they packed in rubber tubings and swallowed, and drugs are taken to prevent the gut motility and smuggled. This is done for purpose of smuggling, which is termed as a body packing. They can be concealed about half a kg of drug by this method. On arrival at the destination, the courier takes the laxative, retrieves the packets and passes them to the pusher who distributes the drug. These packets may cause bowel obstruction, secondary to tourism, interception and impaction. So consumption of these drugs may lead to bowel obstruction. Sometimes it may rupture leading to overdosage and death. Sometimes packets may become unsealed or burst in the small intestine, especially cocaine filled containers, allowing massive absorption and cause the courier's death from poisoning. Even the packets do not rupture, drugs may be passively diffused from the stomach into surrounding organs, including the lower lobe of the left lung, left lower liver and heart, and appear in the circulation and urine. Next form of smuggling is the body stuffers. Here the person once gets arrested may swallow the illegal drug for concealing the evidence from authorities. This is termed as body stuffers. Here the person is not packed the drug, but to avoid getting arrested he may consume the drug immediately. Drugs may be concealed in ears, mouth, nose, vagina or rectum, also known as body pushers. This drug may not be well wrapped and may result in signs and symptoms within a couple of hours. Most packets can be seen in X-rays and are also seen with CT scanning or barium contrast studies. Treatment, usually 10 milligram of IV followed by 5 milligram every 5 minutes until the patient becomes calm, usually provided. Glucose, thiamine and multivitamins is given to drug addicts. Fluid and electrolyte balance and oxygen therapy is given. These are my references. Thank you.